Welcome, everybody, to CodeBlue for Patient Earth. I'm Brenna Dahani, and I have the privilege of serving as the Volunteer Executive Director for Health Professionals for a Healthy Climate. On behalf of HPHC and the University of Minnesota School of Nursing, I'm thrilled to welcome you this morning. We would like to thank all of the wonderful organizations shown here for supporting this conference, as well as our collaborative work on climate and health, both past and future. And HPHC would also like to thank the McKnight Foundation for funding our organization and making educational programming like this possible, and Conservation Minnesota for serving as our fiscal sponsor as we grow our organization from a coalition of volunteers to an independent 501c3 nonprofit organization. We would like to start this morning with a land acknowledgement drawn from language in the official land acknowledgements from the University of Minnesota Duluth. The University of Minnesota School of Nursing, who's hosting the Zoom conference, is located on the traditional, ancestral, and contemporary lands of Indigenous people. The Twin Cities campus resides on land that was cared for and called home by the Dakota people and other Native peoples from time immemorial. Seated in the treaties of 1837 and 1851, this land holds great historical, spiritual, and personal significance for its original stewards, the Native nations and peoples of this region. We recognize and continually support and advocate for the sovereignty of the Native nations in this territory and beyond. By offering this land acknowledgement, we affirm tribal sovereignty and work to hold ourselves accountable to American Indian peoples and nations. The image on this slide is quite literally the view from my window, an 80-acre woodland in Pine County in east central Minnesota on the Kettle River that I caretake for my family. The Anishinaabe people and those who came before them were stewards of this land until its cession in 1837. As a descendant of white settlers, I am committed to learning the history of this land and working to be in right relationship with it. I am grateful to the Indigenous teachers who graciously share their traditional ecological knowledges so that I can learn stewardship that is rooted in relationships of reciprocity. I encourage you all to learn more about the history of the land you are on. The resource native-land.ca is a helpful resource, and we'll make sure to make that available perhaps in the chat. So moving forward, this is the third CodeBlue conference that has been held by health professionals for a healthy climate and the School of Nursing. The first CodeBlue was in 2016 and was actually not called CodeBlue for Patient Earth, but it was the birth of health professionals for a healthy climate. What our founder, Bruce Snyder, reached out to another of our co-founders, Teddy Potter, about hosting a conference at Abbott Northwestern Hospital and was wondering how to get nurses involved in the process. And Teddy said the first thing that we need to do is call this an interprofessional conference and not just a medical conference. And that was the beginning of Health Professionals for a Healthy Climate. 2 years later, in 2018, we had a wonderful in-person conference that was hosted at the Science Museum of Minnesota. And really led to bringing a lot more attention and momentum behind the issue of climate and health. In 2020, we had a wonderful program prepared and ready to go before the COVID shutdown. So we're really pleased to be able to now return to presenting a biennial conference in 2022. And I just mentioned how Health Professionals for a Healthy Climate was born. Our organization has a mission of inspiring and activating health professionals to address climate change through interprofessional education, clinical practice, and public advocacy. Since that inception in 2015, 2016, we've been growing from a coalition of volunteers, as aforementioned, to now being on our road to being a nonprofit organization, a 501c3. We've received grant funding, and we continue to engage in all of these different sectors and are hopeful that we will continue to build membership capacity and momentum, and that if you're not already a member of Health Professionals for a Healthy Climate, this conference will inspire you to join us. Some housekeeping for today's conference. Please use the Q&A function when you want to ask questions. Depending on time, we intend to have a Q&A session at the end of each of our main presentations. You should have received the agenda and other helpful information in the program that was emailed to you. If not, it's available at this Z link. So you might want to have that with you to help to guide your morning. If you did register to receive continuing education credits, you must attend sessions synchronously this morning. We do intend to record and share recordings of this conference after the fact, but for CEUs, it's important that you're actually here synchronously with us. And once the conference concludes, you'll be sent an evaluation link, and it's very important that you fill out that evaluation if you want those CEUs. Further points about the continuing education credits is that these were received through the Interprofessional Continuing Education, the Center for Interprofessional Practice and Education, Office of Interprofessional Continuing Professional Development, quite a mouthful. And they are clear that they have a conflict of interest policy that requires all individuals involved in the development, planning, implementation, peer review, and/or evaluation of the activity to disclose any financial relationships with ineligible companies. And they perform a thorough review of the content of the accredited activity to make sure that all financial relationships have no influence on the content of the activities. And any potential conflicts of interest that arise based on these financial relationships are mitigated prior to the accredited activity. All planners and presenters of this activity completed this disclosure process. There are no conflicts of interest or financial relationships with an ineligible company that have been disclosed by any planners or presenters of this learning activity. And in your program, you'll find more information about the process and what is available as far as the continuing education units that you can receive. Notably, the Joint Commission has relationships with the Accreditation Council for Continuing Medical Education, the Council for Pharmacy Education, the American Nurses Credentialing Center, and the Association of Social Work Boards. And they also have the opportunity to provide interprofessional continuing education units. So anybody from any of those professions or any other health professions can receive continuing education units that are useful for your profession. So I just wanted to end this morning and transitions by talking a bit more about the theme and name for today's conference, Pathways to Resilience. Resilience is a buzzword that's come up quite a bit over the past few years as we've navigated these multiple converging crises, the climate crisis, the COVID-19 pandemic, some political unrest, and the spotlight that we've had on racial issues in the United States and the problem of systemic racism. So to be able to get through all of these converging crises, we keep hearing about the need for resilience. And there's a lot of definitions floating around about what resilience is, but they kind of converge around this idea of integrated adaptation, bringing together the physical, mental, and spiritual health for individual resilience, but also thinking about resilience on a system level of integrating things to a community level and a societal level. And so we recognize that this is the type of thinking and the type of process that we need if we're going to have a possibility of getting through this climate crisis together and creating a livable future. So all of the presentations this morning are going to converge around this concept of how do we build resilience in different areas as health professionals. And with that, although I guess we're actually running a few minutes ahead of schedule, which is never a bad thing, I think it's time that we can move into our first panel. But first I have the honor and privilege of introducing the moderator for the first panel, who is Megs Bell, the program manager for health professionals for a healthy climate. Megs joined our organization in November of this year as the first staff person for what has always been an all-volunteer organization of very busy health professionals. And Megs has contributed so much in the short time she's been with us that really the the wonderful presentation that we put together this morning with CodeBlue wouldn't have been possible without the work of Mags, or at least things would have not been as seamless and wonderful as you're sure to see they will be. So with that, I would like to pass things over to Mags to speak about our first panel.
Wow, thank you. That's quite an quite an introduction. Thank you so much, Brenna. It's actually really been a pleasure to join HPHC. I always make a joke that I've had kind of like a crush on this organization for a long time, and it brings together all the things I'm passionate about. So again, yes, I'm Mags Bell. I'm the program manager at Health Professionals for a Healthy Climate. I just want to say good morning to everyone and welcome you all to the first presentation that we're going to have in 2022's CodeBlue for Patient Earth Conference. Please let me know if you can't hear me. A storm just rolled over my house and I think it's hailing right now. So I hope that it's possible to hear me. And I actually won't take up much of your time because we have an even better moderator than me. But yeah, so we're really excited that you're here. And I am particularly excited to start us off with this amazing panel of experts. As I think most of you know, or hopefully know, one of our main areas of focus at HPHC is supporting health professionals to organize within your own institutions and workplaces. And we know that reducing the healthcare sector's impact on climate change is not only necessary in the work towards a healthy planet, but it's really an opportunity. And I find it to be an exciting opportunity. So we have this amazing, as you can see on your slide, set of panelists today who are gonna offer both a bird's eye view as well as an on-the-ground look at how healthcare systems are doing this work right now. And we're so honored to have them share their expertise here today. So please join me in hearing from Shanda Demorest, Slade, Dr. Micah Niermann, and Stennis. And we will hear from each of them. And then we're gonna have time for Q&A and discussion after that. So remember, as Brenna said, to put your questions in the Q&A box. If this is new to you, I'll just repost this link here. That's to our program, and it has information on how we're using Zoom today if anything comes up for you. And so, yeah, without further ado, I would just love to get us started. I'm going to turn over true moderation, I guess you would say, to Shanda Demorest, who will act as our moderator and help facilitate the conversation here, because we really would like this to be a conversation. Among her many accolades, Shanda is the Associate Director, Climate Education and Engagement at Healthcare Without Harm. And with that, Shanda, take it away.
Thank you, Megs. Good morning, everybody. Before I keep cooking here, I just want to make sure that you're able to hear me. Could I get a verbal thumbs up?
I can hear you.
Awesome, thanks, Megs. Well, thank you so much for the invitation to spend a little time with you this morning. I hold Health Professionals for a Healthy Climate very near and dear to my heart, and of course, same with the University of Minnesota School of Nursing. So Megs, as she teed us up for success here, we will be hearing from 3 key community leaders in climate smart healthcare and sustainability and healthcare more broadly. And before I invite Dina and Micah and Shane to join me, I would like to give a little bit of an overview of climate smart healthcare. Like the term resilience, that's another buzz term that you may be hearing, and we thought it'd be worth a couple minutes just to provide an overview of what in the world that is and look at the broader picture across the United States and even further to get an idea of what's happening in our sector in climate smart and sustainability space. So first, with a definition, climate smart healthcare means this intersection of not only low carbon or low greenhouse gas emitting healthcare as a sector, but also that resilience piece. So while we're learning today about examples from systems doing both of these things, reducing their emissions and building up resilient infrastructure and systems for climate crises and planetary crises more broadly, we know that in order for systems to be climate smart, it needs to be both. So the kicker, which many of you are probably familiar with, is that our own industry does contribute to the climate crisis in the form of not only carbon emissions, but many other types of greenhouse gas emissions. Around 8.5% of our emissions in the country are from the healthcare sector. And this certainly comes in a variety of ways, not only from energy utilization, which oftentimes comes to mind most often for folks, but also the supply chain, our fleet, the food that we're bringing into healthcare, the way that employees get to work, et cetera. And so we like to introduce this frame just in the same way that you use it in your own mindset at home of what we're utilizing, what we're consuming as humans on the planet contributes to greenhouse gas emissions. And the same can certainly be said with healthcare. Now, if we look at the emissions from the healthcare sector, this sort of graph takes some of those clouds from that last slide and gives you an idea of the percentage of greenhouse gas emissions contributed from healthcare and how that shakes out in terms of scope. This is a little more technical than we'll get today, but I just want to introduce this idea that scope 1 and scope 2 greenhouse gas emissions, basically the small portion of emissions that hospitals and healthcare have direct control over for the most part, really contribute a small minority of all the inherent emissions that come within healthcare. So if we look at scope 3, which is this big rest of the pie that includes investments we see here, purchased goods and services, capital goods, employee commuting, transportation, waste, etc. The larger, more complex category of healthcare emissions falls within this scope 3, and that's an important context when we think about basically the influence of control that we have over healthcare emissions, and where else besides within the four walls of the system do we need to be thinking about how healthcare is contributing to emissions? What are the upstream resources and downstream emissions that are inherent within the way that we take care of our patients? And certainly, if we look at the global sector more broadly, Healthcare Without Harm has estimated that our entire planetary global health sector is the 5th largest emitter, if we kind of rank countries, 5th largest emitter on the planet. And so healthcare contributing to greenhouse gas emissions is not exclusive to the US alone. Now, certainly there is momentum developing in this space nationally and internationally. We see the Healthcare Climate Challenge, we see the Healthcare Climate Council, which HealthPartners sits on. We'll learn a little bit more of that. In 2021, we learned the National Academy of Medicine has developed a very progressive and exciting action collaborative on decarbonizing the healthcare sector. There's further governmental movement from the Health and Human Services and the Office of Climate Change and Health Equity. There's this international race to zero. So we're seeing multiple institutions and programs develop for our sector to work towards decarbonization in the interest of that climate smart healthcare and resilience. And health systems across the country have established goals for reduction. So you might see several on here that are familiar, and you'll have access to these slides after. But we like to share this slide because it gives you an idea that there is hope, that our health systems are aware of the need to decarbonize, and that they're working towards that. Now, I have just a couple images from the Global Roadmap to Healthcare Decarbonization, which gives us an idea of what the future can look like and what are different ways that our sector may work towards decreasing greenhouse gas emissions. And this graph looks out for another 30 years into the future for if our emissions continue business as usual, we're certainly not going to reach these zero emissions realities. However, there are some climate commitments in line that will help us reduce We have multiple decarbonization opportunities, but even if we implement all of the technologies that we're planning to, all of the climate commitments that we have made, there's still uncharted territory. We still will continue to release emissions from our healthcare sector. And so we need to be even more innovative and even more creative as we learn how to stop emitting and maybe how to work towards capture a little bit. And if we impose that last graph, this is a similar image, but this gives you an idea with all of these colors, the types of implementation that can have an impact on greenhouse gas reduction. Renewable electricity, certainly. Zero emissions buildings is going to bring us closer to towards decarbonization. Travel, healthy food, low carbon pharmaceuticals, you name it. And so across our sector, we'll need to implement decarbonization. Think about that whole scope 1, scope 2, scope 3, it's going to take it all. So with that, I would like to hand it over to Dana Slade at HealthPartners to give us a little bit of an idea of what's happening down the street.
All right, thank you very much, Shanda. Can everybody see my screen? All right.
Yes.
Okay, good, thank you. Excellent
and actually,
intro.
Dana, it's not full screen yet. It's just on the PowerPoint.
Is it now? Oops, sorry. Is it now?
No, not quite yet. Not
Weird.
from my view, at least.
It's showing in presentation mode on my screen. Not sure what to do.
I might try to just pull the notes bar down and then we'll be able to see the slides a little bigger.
Oh, I know what's going on. Hold on. There we go. Is that better?
Sorry, Dana, not from my view. Mine might be asleep. It's really early where I am. Meg, do you see anything different on your end?
It does. It's not in full screen, but yeah, I think if you pull the notes bar down, I've had a similar issue at times before. I think you just pull the notes bar down and.
Not sure how to do that. Dun, dun, dun. Well, you can see what I have here, and I'm not used to using Zoom. We use Teams at our work, and I'm just going to proceed. If you can see my slides, if that's okay.
Go for it. Great.
Okay. Sorry for the hiccup here this morning. As Shanda said, I'm Dana Slade. I'm the Director of Sustainability Programs at HealthPartners. I've been here for about 10.5 years, and it's been a great ride. HealthPartners is a member of the Healthcare Climate Council, and I just want to preface my presentation here with a couple of introductory comments, and then I'll dive into our brand new Sustainability Goals 2025. And this is the first time that we're publicly speaking about these goals. So you guys are my guinea pigs for showing off our new long-term goals. And I want to say before I start, though, that this was a process. It took us about 18 months to come up with our five-year goals. And the pandemic actually helped us. We were able to be a lot more intentional and thoughtful about how we committed to our 5-year goals. We did much consultation with sustainability experts across the country, including Shane Stennis, who you'll hear from later in this presentation. And I really appreciate all the input and insight that people have given us as we developed our goals. The other thing I'd say is that the pandemic and the murder of George Floyd definitely influenced our goals as well. And so I think that these reflect really where we're at right now and where we want to go and where we need to go. And so now I'm going to share our a little bit behind the scenes on how we made the sausage. And don't worry, it was vegetarian sausage, so it's all good. So we have 5 goals. Our first goal is related to reducing our scope 1 and scope 2 emissions. And you can see our goals there, 20% by 2025 with a 2018 baseline. Shanda did a really good job of introducing the 3 different scopes. So I'm not going to spend a whole lot of time going through that, and hopefully we'll have more time to have Q&A at the end. And the one point I want to make here, though, is that this is important because air pollution causes deaths, and it's been estimated that over 4,000 deaths in Minnesota were caused by air pollution. And this is important for us to address and realize that we have an obligation to really impact the health of our communities. We're going to rely on our utilities. We are fortunate in that our main utilities, Xcel Energy and CenterPoint Energy, have pretty aggressive goals, some of the best in the country. And we're going to really rely on them to help us lower our scope 1 and scope 2 emissions. However, that doesn't mean we're not going to continue working on conservation and renewables. And we'll probably have to buy some sort of offsets too as we head forward.
Dana, we still can't, we're only seeing slide number 1. So if you can advance your slides, that would be great.
I have been. I am not sure what's happening. Let me stop sharing and try to share again.
Okay. If not, we can also have you email them to your moderator, to Shanda, and she can pull it up on her screen.
All right. I sent them to Mags.
Okay.
All right. Can you see them now?
Much better.
Yeah. And so, Dana, do you have an option that says swap presenter and slide view?
I do. I did that once. Is that better?
Because what we're seeing is your presenter view now. So it is better. We're seeing your slides advance now.
Okay, I am not sure what's going on. It's probably a bad internet connection on my end. I apologize for that. Okay, are you seeing my number 1 goal right now?
Right now it's on number 2.
Yeah, assess scope.
This is wacky. Okay, what are you seeing? Which slide are you seeing now?
Yeah, now
1.
we're seeing 1, reduce scope 1, scope 2 emissions 20% from.
Okay, did it switch?
It did switch, yes.
Okay, we're heading in the right direction. Okay. Sorry about this. So our second goal is to assess our scope 3. And as Shanda said, there are 15 categories in this area, and it makes up 71 to 82% of healthcare emissions. So what we did intentionally is this is where we want to focus. Our utility is going to help us get our scope 1 and scope 2 emissions down. And this is where HealthPartners is going to focus going forward. We think we know which of the 15 categories are material for us, but that's the first thing that we're going to do is do a materiality assessment of our scope 3 emissions, and then come up with a game plan for working with the various partners that we're going to have to in order to do this. Because as Shanda said, these emissions are not under our direct control, and we're going to have to partner and leverage relationships with the various vendors and service providers that we use. All right, hopefully the slide moved. Our third goal is all about reallocation of our budget. We know that a certain part of our budget is already being spent on local and sustainable services. What this goal is all about is increasing that. And we really want to focus on minority and women-owned business enterprises and look at it with an equity, inclusion, and anti-racism lens too. We've identified our top 26 spend vendors and service providers, and it's almost $1 billion in spend. So it's going to be significant. We are going to include our services and our construction and food. We already have a great handle on our food service. Waste is a big problem in healthcare. I've thought about this long, I've thought about it frequently. There is no type of waste that healthcare does not generate. A lot of it is plastic and most of it's disposable, and that certainly hasn't gotten better in the pandemic. So our goals that we set here for this task is to divert 40% of our waste from our clinic and administrative buildings, and the metric that we use for our hospitals is pounds per adjusted patient day, and we've selected 15 pounds. Our hospitals right now are somewhere between 13 and 18, so we're well on our way to this. We want to focus on increasing our organics diversion and decreasing the amount of plastic that we throw away, including styrofoam. We don't buy styrofoam at HealthPartners anymore, but we still get it in our packages and things like that. So that's something that we really want to focus on going forward. And our last goal is employee engagement. So this was one of our goals in our previous 5-year set of goals, and we had the metric of getting everybody over 90%. And you can see prior to the pandemic, most of our facilities were over 90%. So we were optimistic that everybody was going to get there. The pandemic hit and people forgot about us, or they had other priorities. So this is something that we're really focused on going forward. We have had an Earth Day campaign, and that's a great way to phrase it, because we have just flooded our communications venues with Earth Day events, and it's I'm pretty tired with Earth Day being yesterday. So here's a nice summary of all 5 goals on one slide. I want to emphasize that we have been doing this for over 10 years. And I know that there's some health systems that are on the meeting today that are thinking, wow, how do we get there? And the best advice I can give you is to don't freak out about how big of an elephant it is. Think about just doing something. Do it and then do something else and use the momentum and get engagement from your staff, your colleagues, and really make progress here. You won't get there overnight, but you'll never get there if you don't start. Start somewhere and just do it. And then the last thing I wanted to announce here this morning is that the Federal Health and Human Services Department made an announcement yesterday with reducing their carbon emissions from the VA and the Department of Defense. And they've asked for private health systems to join in that. And I just got approval from our CEO. HealthPartners will be joining and signing that pledge. And I ask for other organizations to do that too. We need to do this together. This is not competitive space, and it helps all of our communities improve the health and well-being of the patients and members that we have. And with that, I will be quiet and turn it back to Shanda. Thank you.
Dana, thank you so much. I'm taking copious notes on all of those goals that you're sharing across the spectrum. So we appreciate you sincerely, and stay here because we're going to open up for Q&A in a little bit. But I think next, Micah, we get to hear from you, Dr. Micah Niermann. And Mags, if I understood some of the back chat, you'll be the one sharing the screen for this round. Terrific, we're getting that puppy up and going. So Dr. Niermann, after Dana's terrific overview of what's happening at HealthPartners, let's hear what's going on at Gillette Children's.
Yeah, thank you so much. And thanks for the opportunity to be here this morning. So my name is Micah Niermann. I'm a med-peds physician by background, and I've been at Gillette Children's for about 2.5 years as their chief medical officer. So we know that climate change is a health crisis. We also know that healthcare systems are one of the biggest emitters of greenhouse gases, as you were pointing out this morning. What is exciting is that healthcare is pushing in the right direction with leaders across the country and here in Minnesota who really recognize our role and accountability in this problem. And by addressing climate change as healthcare systems, we are abiding by our rule, first, do no harm. Next slide. So where is Gillette on this journey to improve our impact on the climate crisis? And what have we learned so far? And what challenges do we see before us in this work? Gillette has not incorporated environmental sustainability into its strategic plan. We haven't, as a result, made it a priority when addressing suppliers or capital investments as examples. But as I was soon to learn, that doesn't mean a lot of activity isn't happening. So about 5 years, there was an employee on our facilities team who had started a green team, and they had initiatives around reducing waste through recycling and eliminating disposable cups and utensils. And this was truly led by one person and not elevated as an organizational priority. He left and the momentum fizzled, and then we also entered the pandemic. Next slide. But there is work still being done. I began to ask other leaders in facilities, supply chain, pharmacy, and anesthesia about any efforts with reducing greenhouse gases. Facilities, or environmental care, as they're called at Gillette, and their leadership were already replacing lights with energy efficient lighting. And the skyway that you see here has been covered by plants across the entire roof, but the savings were never tracked. Next slide. I also talked with our anesthesiologists, and they were well aware of the greenhouse gas impact from anesthetic gases, especially desflurane. There is an advantage to desflurane for a very select group of our patients, but the team already restricts this use. But the savings and the tracking of its use weren't done. Next slide. Gillette also benefits from sharing facilities with regions because we share the same power plant. We're located on the same campus. And we also send our waste through regions. But unfortunately, this means we have not developed a good way to quantify what the amounts of waste generated are from Gillette. So instead, our facilities team decided to focus on their own to look at the cradle element of materials by working with procurement suppliers to limit their packaging. But this hasn't been tracked either. Next slide. But efforts are happening. The more people I approach, the more I learn that Gillette is doing something, and people are excited. I see more EVs in the parking garage. Administrative assistants are still making sure people bring in their own utensils and cups into the offices. In supply chain, we partner with a supplier to recycle and reuse pulse oximeter leads and sleeves for leg compression devices that prevent blood clots. We also partner with Matter, a nonprofit started here in Minnesota dedicated to distributing used and surplus equipment across the world to other clinics and hospitals who are in need. And our Director of External Affairs has been tracking legislation on climate change, and we are looking to see how Gillette can add its voice to these legislative bills. But as you can see, despite these efforts, the improvements are individualized, siloed, and sustainability is not top of mind with larger decisions for the organization. Next slide. So we need coordination. Talking with the team at Regions, they have been incredibly helpful, and there is more to build in this effort with Gillette and the guidance from Regions and HealthPartners as well. But I've also been picking Dana's brain a lot lately, and he already has a full-time job. And this led us to practice Greenhealth, and we've just started this membership. Efforts to mitigate climate change, much like quality and safety, diversity, equity, inclusion, employee engagement, all share similar themes of strong metrics, collaboration, equity, well-being, and most critical, tying it to the mission. Next slide. So I covered Gillette's journey so far, but what are the challenges before us? First is prioritization. Gillette is relatively small and many of us wear many different hats. So there is little bandwidth with all the staff, and resources. Nevertheless, there is excitement about the work across the organization. We are fortunate because our CEO understands and appreciates the need and sees the link to the health of our community and the disproportionate impact it has not only on Gillette's patients, but on all underserved populations. The other challenge is communication. How do we communicate effectively with everyone at the organization, staff, patients, families, about the individual and organizational role to address the most important problem of our time? We need the tools and the time to understand what they value and what they know about climate change. What piques the interest of the CFO may be very different from an anesthesiologist. The Providence Health System, for example, I recently learned that they closely track in real time the use of anesthetic gases down to the individual provider level, which has created a lot of competition and an incredible amount of benefit. But these are typical challenges for any change on a large scale. And I'm excited and optimistic because they are already, because we have grassroots energy and a commitment from the top to move us forward. Not only are we joining a collaborative community like all of you are here today too, and we're all dedicated to making the world a better place. So thank you very much.
Terrific. Well, thank you, Dr. Niermann, for joining us this morning and sharing more about the burgeoning sustainability and climate resilience developing at Gillette. Next, I am delighted to invite Shane Stennis from the University of Minnesota to join us. And for folks who may be outside of the community, certainly Health Professionals for a Healthy Climate and the CodeBlue conference is applicable outside of the healthcare sector. But Shane will tell us more about not only sustainability and climate at the University of Minnesota as an educational institution and as a campus, but also the affiliated connection, mHealth Medical Center. And there's also that intersectionality of the actual infrastructure of medical facilities related to the University of Minnesota as well. So Shane, please do join us. We'll get a screen share going and hand it over to you.
Good morning, everyone, and thanks, Shanda, for the introduction and for kind of setting the context. I really appreciate it. So while I'm sharing my slides, just want to confirm, can you see my presenter or my full screen?
We can see and hear you well. Perfect.
Excellent. So thanks again for the opportunity. Besides being really passionate, of course, about sustainability, I also have a personal connection to healthcare. I have a number of family members who work in healthcare and really know the power of the work that you do and the broader impacts that healthcare sector workers can have. My mom just retired from a 40-year plus career in nursing with her last post being at Bethesda. So it's near and dear to my heart, and certainly I know the impact y'all have. As Shanda described, I'm going to talk a little bit about the context of the University of Minnesota for about 5 or 6 minutes and hopefully give enough flavor so we can have a great conversation and facilitate the Q&A. And I think, everyone here on the presentation today or on the call today probably knows the University of Minnesota well. But just as a little bit of background, we're the state of Minnesota's land grant institution. And that, of course, comes with some baggage and some, sort of deep-seated issues with how that came about, as Megs and others had, or during earlier portions when we were talking about a land acknowledgement, the university derived its lands. They were taken from tribal governments and tribal communities, often forcibly. And so that's part of our legacy that we continue to grapple with today. But with that land grant institution focus, we obviously are playing a role across the state of Minnesota. We have operations in all 87 counties of the state, and our mission is not only to provide teaching and research to our students, but also to think about how do we translate that knowledge and that expertise and bring it to the benefit of communities and residents across the state. We have 66,000 students across our 5 campuses, 7,000 of which are health sciences students, either nursing or medical, pharmacy, in a number of other disciplines. And so, the health sciences component is such a critical piece of what we're delivering as an institution in terms of our educational mission. And obviously, we also have a really huge impact on research and clinical care as well. Last year, we awarded 17,000 degrees across the entire University of Minnesota system. Of those, 2,000 alone were in the health sciences area. And so, again, this is just a huge part of what we do. 70%, I think, of Minnesota's health care professionals are U of M educated. So, we're playing a critical role in terms of preparing future generations of healthcare and health services sector workers in terms of their training and their ongoing professional education. And as Shanda had talked about, we have a really close relationship with a number of healthcare providers, most notably on the Twin Cities campus, where I spend most of my time and the bulk of my role is. We're associated with and have a hospital, mHealth is our, our collaboration with Fairview and physicians. And we have a hospital on our East Bank campus that we are directly connected to from a facilities perspective. But like, Gillette's experience with regions, we're also in this very interesting space where, M Health and Fairview operate the building and the operations that are going on in it. But the University of Minnesota provides a lot of the services like utilities, steam, electricity, as well as waste management services to those facilities on the East Bank of the university's Twin Cities campus. And so that, interconnection between our university academic operations and the operations of the hospital and the clinic and surgery center that's nearby are, really intertwined, which poses both, a unique set of opportunities as well as challenges that we'll talk about, I think, much in the Q&A. So I know Dana and Dr. Niermann had talked about, kind of setting the stage around, like, so how does this work happen? And for the university, I would say the first and foundational piece of it for us is that we've embedded it in policy at our highest level. And organizations can take many different approaches to how to advance sustainability in their institution or their organization. And for us, the policy aspect of it really does lay a foundation and set the floor for the work that we're doing. So in 2004, the university's Board of Regents, which is the governing board for the university, established a sustainability policy, which is still in place today. And it guides, our actions and sets our guiding principles in terms of how we roll out sustainability across the institution. And that policy really envisions that sustainability is across the mission. It's not just compartmentalized in one sector or one part of the university, but it really is integrated in all the things that we do. That's not to say that we do it perfectly. We have lots of opportunity for improvement, but there is a real commitment to thinking about how do we comprehensively embed sustainability into the work of the institution. And along with that, we also have, there's a couple keys I think that really have driven us since the policy was established. And one is engaging everyone in the work of sustainability. On our Twin Cities campus, we have a campaign called It All Adds Up that is really focused on this idea that small little actions on their own, but executed by individuals or maybe put in place by a department, maybe if they were just that person or that department wouldn't have a huge impact, but collectively we can add up to big impacts because of our size, because of our tens of thousands of students and our 20,000 employees in the Twin Cities and all the scope of activity that we have. Collectively, these things can really have a real meaningful impact on outcomes when we take them in total and aggregate them. We also have a real history and emphasis on grassroots leadership. And this is, in many cases where a lot of our innovation and good work happens or starts at. And I just put two examples on the screen that are connected to, the health sciences field. One is our climate health action program, which, has really been led by a number of physicians from M Health and physicians, as well as medical school students and others who are really passionate about trying to advance climate change and the work that is being done both at Fairview as well as the University of Minnesota. And then there's also a climate change and health curriculum group that has created a number of tools for health sciences instructors and faculty members in different areas that they can then bring into their classroom and start to integrate into that health sciences education. I think the other key piece for us has been making commitments and following through. In higher education, there actually is an organizing framework called Second Nature Climate Leadership Commitments for channeling, climate commitments across institutions. And so that's something that the university has belonged to since 2008. As part of that, we are required to publish, we're going to reduce our greenhouse gas emissions, and we published our first plan in 2011 and set an ambitious emissions 50% by 2021 as compared to 2008 numbers. And that plan also talked at a high level about how we're integrating climate change and climate protection into our teaching research activities, as well as other endeavors at the institution. And then, more recently, we've taken some steps to embed sustainability into our strategy. So in 2020, right in the throes of the pandemic, we adopted a new system-wide strategic plan for the institution. And so this plan guides all of our activity across all of our locations and across all of our undertakings and endeavors that we're doing. And it really focuses on, our service to the state and how that service impacts the world. And as part of that, we're really, I think, institutionally made a commitment to thinking about how sustainability is advanced through that plan, and actually called out and established a goal around building a fully sustainable future in that planning document, and identified a few sub-actions related to that activity and that endeavor in the plan itself. So the first time we've had a system-wide strategic plan, and it's the first time in our strategy document as an institution, any strategy document, that we've really embedded sustainability upfront and comprehensively, and said that this is something that we're aspiring to as an institution. So it's kind of the next step, and it's still relatively new for us because, as you all have experienced as well, the pandemic has sucked the collective oxygen out of our capacity to advance other things. And so we're just now getting back to this and saying, like, what does this mean for us institutionally, and how are we going to put this into action? How are we going to make this commitment a reality? And the final thing I'll say is all of this work, the grassroots leadership, making commitments and following through, embedding things in policy, embedding things in strategy, have had positive outcomes. Our climate reduction goals and our climate ambition is focused on, like I said, reducing emissions. And we've been able to realize the goals we've set because of those things that we're doing, because of that grassroots leadership, because of engaging everyone in the work, and because we made commitments and then figured out ways that we follow through. The thing I will kind of point out this number 2 is, while doing this, we've also saved money. And I think that that's something that sometimes in sustainability world, we're kind of loath to talk about, but it's really important because it does speak to the CFO, it does speak to the financial office, and it does actually create momentum for doing more work. So that number there comes also with a kind of a millions of dollars each year in annual savings as a result. And so with that, I'm gonna wrap up and look forward to the Q&A and talking more about this topic and hearing from all of you.
Super, thank you, Shane. I pulled out so many threads that that each of you spoke to. We heard about journeys, we heard about some of those objective goals that you're working on setting, also some of the challenges around metrics. We heard about tying this work to your mission and some of the development around strategy and policy focus. So super exciting. Dana, Micah, Shane, thank you all for giving us an overview of what's happening at your institution. So let's shift now to the Q&A. We're seeing a couple come into the chat, so this is excellent. Thank you. I think first I would like to lead with, how can health professionals get started in this work? So maybe particularly folks who aren't in administrative positions. And Micah, I think because of your clinical background, I'd like to start with you. So how can health professionals get started in this work who aren't in an administrative role?
So I would say, I think twofold. One, I mean, if it's something, this is obviously something that's incredibly important and we're very passionate about. So continuing to pursue it, despite maybe a lack of centralized support. And that certainly has happened at Gillette. Although I think the other part though too is maybe that recognition within the organization, I think, at least for Gillette, has been either one, not really fully appreciating it. And that really gets then to education. So I think as providers or those who are maybe not in administrative roles, being able to understand how to speak the language for the leaders who they need to engage and what those leaders value, and that can be kind of difficult. So at that point, then it means identifying, some leaders who already may have an interest and really engaging them and start to leverage their work. I mean, I know that, for example, I mean, it's easy. I mean, this is an easy example to pick out, but anybody in finance or the chief financial officer, what they see first and foremost, you know, are the financials. So really being able to tie this work to the financial sustainability of the organization, and that can really grab their attention. But then also thinking very creatively too about the efforts. You know, looking at how, you know, how is the workforce managed in a sustainable effort? You know, does that mean more people working from home, doing hybrid, maybe not occupying as much office space? So there are different ways, I think, to approach it, but just not to give up. I mean, it's incredibly important, and to continue that communication. And then also too, I mean, even in my role, I mean, I picked Dana's brain quite a bit on what they were doing and how I can do that within my own organization, because so anyway, yeah, and it doesn't have to be right within your own organization. But it would be interesting too, I don't know, for Dana and Shane, what your experience has been on that. Sorry, Shanda, if I jumped the gun.
Yeah, I was just going to offer, I think, two things that I often refer back to and actually talk to students quite a bit about. And I think they're transferable to any age and any sort of place you're at. One is there is, and I'm sure folks have seen this, something called Project Drawdown, which is a national organization that really focuses on climate solutions and trying to identify what those are. And they published a wonderful book about this, a number of books about this. But they have something called Project Drawdown Climate Solutions at Work. And I think it's a good place to start because it gives a kind of structure and a framework for thinking about what are the things you do at work every day that might be an opportunity to, you know, positively impact climate change and to work on this as a topic. The other thing I'm really fond of referencing is, and I can't claim credit for this, this comes from Dr. Ayanna Elizabeth Johnson. She's a marine biologist, a writer, and a climate leader. She often talks about this idea of like creating a Venn diagram and thinking about the things that you're good at and the things that you love to do and the things that the climate movement needs. And the intersection of those three things is what you should be doing. Because every job is a climate job. All of us have, you know, climate change to work on. You know, we all can contribute, I think, is the message. But you don't all have to contribute in the same way. And so finding that thing that's unique to you and that you feel comfortable doing and that you're good at and you love, because you have to have love and passion for something if you're going to maintain it, because some of this work gets hard and it gets tiring. So I think that those are the things I really encourage people to focus on, is, you know, defining that specific thing for you that really resonates.
So I would add two things. I agree with everything that Micah and Shane said, and that's definitely the way that we've approached things too. The other two things I would add is most of our organizations are nonprofit mission-driven organizations, and make the tie with your sustainability program to the mission, vision, and values of your organization. And that way, in our case as HealthPartners, our department of 2 has broader reach to 26,000 people, because everybody is working in healthcare to support the mission, vision, and values of the organization. The other thing I would say is sustainability doesn't have to be a drain on the bottom line. In fact, if you do it smart and you do it well and you do it intentionally, you can make money. Even through the pandemic, we have calculated that our sustainability initiatives have saved the organization $4.2 million over the last 2 years. That shocked me when I started adding things up. Sustainability pays if you do it well and you do it smart and you do it intentionally.
Nice, nice. Dana, I want to go a little bit further into what you just referenced at the end there, the cost piece of this. Micah, I think you referenced it during your intro as well, tying sustainability and climate resilience to the bottom line. We had a great question in the chat that, you know, goes even beyond operational sustainability savings. They ask, you know, as we're moving towards 2050, where we have these big international goals to get to net zero emissions, et cetera, in order to make this work more affordable from a big picture perspective in healthcare, is there anything we should consider working back from, stopping doing, such as expensive concierge care, specialty hospitals, high cost imported patients. How are you framing some of that cost angle from some of the like the least types of sustainable care, the really high resource patient care? And I know this gets into ethics a little bit, but I'm curious of folks' thoughts. And Dana, I don't necessarily, I'm not kicking it back to you per se if you need a little more thinking time on that, but how do we look at the ethics of the costs of healthcare and what that means in terms of sustainability?
Yeah, I can start off, and then I'll be quiet and let others speak about it. I think one of the things that we found through the pandemic is using technology. Meetings like this save time, it saves carbon, and it saves money. And it's amazing how much that saves. Just one example, we have switched to almost all virtual meetings now. And so I used to drive to our hospitals and clinics and get reimbursed from our organization. We calculated that we saved $1.2 million a year by not driving to meetings. And it's amazing how much that savings wraps up. Our administrative employees cut back on their commuting time and mileage by 64% from 2019. I mean, huge savings. And those all go to improving the health and well-being of the community, right? So you're not putting that carbon in the air. So, those are just a couple simple examples of how you can change the way you operate to make improvements.
Maybe, yeah, Danny, you're exactly right. And Shanda, I would say too, I think your question also gets at the heart of healthcare and just in how we're reimbursed. I mean, we are still fee for service. So we're getting paid to do stuff, which also makes uses goods. We're not paid in the prevention. So, for example, like what, Dana's example gave, having a lot more of that outreach, that primary care intervention that could be done, through virtual care, for example. There are a lot of ways that we could begin to think about how we deliver healthcare differently that will also have direct impact on the climate. But I don't know if that's also a huge undertaking. And I would imagine as the climate worsens and the financial unsustainability of our current model continues, these may be coming kind of at a crossroads, maybe just at the right time.
Thank you, Micah. So the next question I'd like to pose from our audience, kind of combine two here. What have you found is the best way to engage community and staff in sustainability work? And then let's also add patients to that. Or students, Shane, what's the best way to engage folks who aren't traditionally on your staff in this sustainability work?
Yeah, I'll start with students because they're something that we're very close to every day. I don't want to be cliche, but I think it goes without saying that our students and students generally are deeply interested and super passionate about sustainability. And so they are often, pushing us to be more aggressive, more bold in the actions that we're doing. And so they are a really constructive influence on ambition setting and maintaining the pace and the scale of the work that needs to be done. The way that we've engaged them has really been really varied, and again comes back to that idea of like finding sort of what they're passionate about and what they're interested in, and then trying to engage them in different outlets. And they also do a ton of self-directed stuff that we have no engagement in, and a lot of it is, and this is true for staff as well and faculty members that we have, is we kind of find two things are really useful. One, get out of the way sometimes, don't be an obstacle or a barrier to progress. And two is, how do we think about ways that we can reduce organizational friction? We know that there's a lot of friction and inertia in systems. And so sometimes it's just like greasing the skids with money or relationships and connections, just to say like, if it's a few $100s keeping you from launching a really cool program that you're super passionate about, we can find resources. You know, like I said at the beginning of our slides, we're a $4 billion organization. We should be able to find, you know, kind of money in the couch cushion, so to speak, to be able to make great stuff happen. So I think those are a couple different ways that we've really approached it.
So I'll add a couple additional things here. And I saw those question in the Q&A. Sustainability is a determinant for where people work. So we've used, and I have been personally spoken to by new employees. They've sought me out just to tell me that they chose HealthPartners because we have a formal sustainability program. So I think that's a softer thing. You know, I think the question was saying, yeah, sure, if you save money, that helps, but it also helps attract staff. It helps retain staff, and that's huge. And riffing off what Micah said a little bit, get your data, make sure it's bulletproof, and then talk about it, and talk to anybody that will listen to you about it. And then as your message gets out there, more and more people will come and seek you out, because this is something that organizations and people are interested in. I interacted with Teddy because of our communications and our reports and our awards. Really play that up, because there is so much soft benefit in that. And I don't do it because I have a big ego. I do it because I'm passionate about improving the community where we live, and reducing the impact our operations have on that community. And I'm just a figurehead for the work that many, many people are doing. And I will talk passionately about it for as long as people will let me do that.
Thank you, Shane. Thank you, Dana. Micah, I'd like to ask you the same question to kind of get your take, because Gillette Children is a specific population. You know, certainly we have the pediatric population that is one of the more vulnerable populations to the climate crisis. And I think that from a strategic perspective, from leadership, really positions children's hospitals in a unique place. And obviously Gillette has a lot of community relationships. You've referenced DEI, you've referenced some other sort of strategic initiatives that Gillette is working on as well. Is there anything from a community engagement perspective that you're thinking about at this stage of your program development?
That is a great question. No, not really. I mean, we haven't, as far as sustainability is concerned, no. However, that doesn't mean that won't be a part of it. I think that for our families, and I think this is where the communication is going to be really critical, is making sure that, when I talked about before, of really trying to understand what our families and our patients understand about the impact of climate change, and that we have a better understanding of what their needs are, both thinking of it in terms of, just, resources, emergency preparedness, their ability to sustain, longer stretches of heat. I mean, what are the, we have a lot of patients who are on ventilators, who require, a consistent source of electricity. So with more major storms coming through, what is, how will they be able to cope? But that's just Gillette's population. We also, we're right there in, downtown St. Paul. And so there are a lot of populations there too, who, we are very cognizant don't have access, not everyone has access to healthcare resources. So I think, for us, I mean, that's something that we have to be able to flesh out and make sure that we tie in really well together. As Zayden pointed out, not only to the not only for our mission, but how we're tying that in together also with, for example, DEI, because those two are so closely intertwined. But yeah, it's going to be a work in progress.
All of this. Well, yeah, Micah, thank you. I appreciate that. So with a few minutes left, I'd like to do a little speed round, and you have a captive audience here, right? You have health professionals, you have students, you have future sustainability leaders within their health organizations. So we'll go in alphabetical order, which is Dana, Micah, Shane. If you could have these audience members come away from your presentation day and do one thing, like action oriented, right? Do one thing. What is that recommendation in 30 seconds or less? Dana, I'm going to kick it over to you.
Yeah, just do something. Do something that has an impact on the environment, on the community. Doing something is 100 times better than being paralyzed. So don't sit there, get off your butt, go do something.
Dana, thank you. Over to Micah.
Yeah, Dana's exactly right. Yeah, and talk about it. And then actually educate yourself as much as possible. I think that would be the other key.
And I would just add to what's been said, recognize that this work is, we often talk about it in an environmental context and we measure it in units of energy or emissions, but it's really about people and communities. And so connecting it back to that, I think, is really critical.
Thank you, Shane. And my ask the day after Earth Day, right, is to think about yourself as a human on this planet. We're not cogs, we're animals that are trying to figure this out all together. We're social creatures, and so being in community like this, whether it's Zoom or whether you get your butt outside and engage with the world around you, that personal connection and developing our story really helps us anchor our heart to this work. So Megs, Brenna, HPHC committee, thank you for allowing us to have this conversation today. Dana, Micah, and Shane, it was a pleasure to learn what you're up to within your institutions. I know there were many questions that we did not get to, so do take a peek at that Q&A if you have a moment, or even in the chat, and fire off via text a little bit more. We look forward to seeing what else you've got in store for the session today. Mags, I'll hand it back to you.
Excellent, excellent. Yes, thank you so much. Wow, I mean, what a panel to start us off. It was everything that I hoped for. I wish we could talk about this more, which, I mean, we can, just not right this moment. But I'm beyond grateful for our panelists. Thank you so much for what you shared. I really am like moved by those, and thank you, Shanda, for those last few comments around, do something, be in community. It's about the relationships. Yes. So yeah, I just find it really inspiring to hear about what you're all doing. And I learned so much whenever I talk to any of you, and there's so much we can just do from where we are every day. So thank you. And thank you for all the wonderful questions. Yes, definitely. If our panelists feel up for it, hop in the Q&A, really great questions. And if you are moved by this panel to do more to get involved, there are lots of ways. I think that some different links have been dropped in. I will also just drop this email in, which is the general email for health professionals for a healthy climate. So if nothing else, you can always shoot us an email, ask how we can connect you with folks who are doing the work in the institutions that you're in. So yes, thank you to Shanda, Dana, Micah, and Shane. Really appreciate you. Please reach out. We'd love to connect all of our attendees more with this work. And it's 10 o'clock. So wow, look at that timing. We are going to take a 10-minute break. So go stretch, get some more coffee. That's what I'm going to do. And we will be back here right at 10:10 for navigating the mental health impacts of climate change. Thank you so much, everyone.